Okay, so let's do so. Hello, everyone, and please feel welcomed at the third roundtable of the German-Israeli Health Forum on Artificial Intelligence. While the first two events early on this year focused on technology and security, as well as on regulatory issues, today we will fully concentrate on communication and trust. And you may have read it in the paper that we published for this event. It's written in the EU Product Liability Directive just from this September in the revised version that AI technologies can only flourish in the European Union if people trust digital innovations. And we at the German-Israeli Health Forum for Artificial Intelligence, we find that both personalized trust in the context of the doctor-patient relationship on the one hand, and trust in evidence-based information leads to greater trust in AI. So having said that, ELNET is still very much delighted to host this German-Israeli Health Forum on Artificial Intelligence, which, as you who have been with us before know very well, is funded by the German Federal Ministry of Health. And within the scope of GIHF-AI, we host roundtables like we do today again. We connect experts like you joining us for this roundtable, but we also publish policy briefings and political recommendations to drive the digital transformation of our healthcare ecosystem, connecting Germany and Israel, learning from each other how to better apply artificial intelligence. So please always feel free to have a look at our website to find all the policy papers, all the policy recommendations. Reach out to my dear colleague Leah, who is the program manager in charge, myself or the rest of the team, or meet us in person, for example, at the first annual conference of GIHF-AI that will take place later on this year, November 28th to 29th in Tel Aviv. Also here, I already want to thank the Israeli Ministry of Health for their support for realizing this important conference in Israel. So without further ado, you didn't join for the marketing aspect, but rather for the discussion. So I'm delighted to welcome our two keynote speakers. The first will be Professor Dr. Ronni Gamzu, the CEO of the Tel Aviv Sourasky Medical Center, the Ichilov. He's also a member of our board of trustees of GIHF-AI. Ronni, a pleasure seeing you online again. Has been a couple of weeks. Has been a couple of weeks since we met with our last digital health delegation in Israel, and looking forward to seeing you in person soon. And the second keynote today will be from Alexandra von Korff, the CEO of yeswecan. And both keynotes will be followed by a short Q&A. And afterwards, I'm happy to pass on for the panel discussion that we will have in the context of communication and trust, which will then be moderated by Professor David Matusiewicz. I hope I got this right. And so again, a warm welcome to all the panelists, to our keynote speakers, Ronni and Alexandra. Again, great having you with us today. And usually I would say ladies first, since it's a bilateral initiative. Ronni, on my agenda, you are first, so I'm happy to give you the mic.
I didn't hear your last sentence.
The floor is yours, Ronni.
Okay, so thank you very much, and I'm happy be here and to have this speech about AI. And you know, the first question that we have to look is why healthcare is lagging behind other industries in AI. And we see AI very ahead in many industries. You take it, you know, technology, cyber, fintech, any industries in the world is using data in order to make services better. However, in medicine, we see that we are not using our data. Now we have the data within our hands. However, we do not construct out of the data enough insights in order to do medicine more accurate, faster, tailor-made, and better. And we are still wandering in the dark and using many of our diagnosis and treatment on the average, and not doing a more precise way of running our services. And this is a wide gap from other industries, including, any industries that were developed in the last 20 or 30 years in a way that they have produced progress that we do not have that in medicine. And you come to think, why is medicine, is our healthcare services in hospitals or in the community is still not using the data in order to make the services better, more accurate, more efficient. And usually we tend to say that the real reason is that medicine and healthcare diagnosis and treatment altogether is very complex. And it's so complex that even though you have huge amount of data, it is almost impossible to have algorithms that will do the physician or nurse task better or more accurate. It's too complex. The biological uncertainty is so complex that you cannot do it. However, this is not the real issue, because many other industries have done some and go through some complexities that are no, in any sense, that are not more complex than medicine. And using the tools, using the resources, using the great minds, using data scientists, you can solve many complex problems. So this is not the real issue. This is not because healthcare or medicine is more complex. The real issue is that we are dealing with physicians that are too conservative in their ideation and the use of data in order to make medicine better. So the first issue is trust. To make physicians trust AI tools, trust algorithms, trust black boxes in order to diagnose sepsis beforehand. Early onset diagnosis of sepsis, you need the physicians not to follow hundreds or dozens of parameters continuously because they cannot do the analysis. They have to trust. They have to trust black boxes, to trust algorithms, to trust AI technologies and machines, deep learning machines that were made by data scientists. And this is a culture change. And the most important task that I'm doing daily in the Tel Aviv Medical Center is to create a culture that my physicians, no matter where, my scientists, my healthcare scientists, no matter where, in the ICU, in the delivery room, in the ER, anywhere around the hospital, in the operating theater, will trust, algorithms that will tell them, you know what? The next thing that you have to do is this thing. The next thing, you know what? You do not see that. But there is a clear indication that you have here a pulmonary emboli. You do not see that. But getting many parameters all together creates our understanding. There is a high chance of, an MI. There is a huge chance that you have here appendicitis. And this way of thinking, it's, very innovative in medicine. And usually in medicine, we are using our senses, our eye senses, our way of thinking, analyzing, sensing by, feeling, and trying to hear, trying to manipulate some parameters. But how many parameters can we deal with? So we have to trust algorithms, computers that are doing online continuous analytic tasks. And I see gradually that we are building the trust. I see gradually that my physician can trust, the machines, take it, the AI in imaging now. We have in our hospital, within the ER, our ability to give decision support to many diagnoses before the radiologist can say what he sees, whether it's a chest X-ray or a chest CT, or whether it is a broken arm. The computer will see that beforehand. The same thing in pathology, and the same thing in ECG. Building the trust is letting them inside the laboratory of the data scientist. It then understanding what is algorithms, why they are almost the same as doing your own research, using, your clinical data, your clinical insights. And this is what we have done and accomplished that in many other fields, in many other industries. Medicine should not be different on that. But in order to accomplish that, we have as leaders to put a lot of resources to do that daily, to believe in that, and to create the infrastructure technologically, take all the data, and to embrace AI technologies within your healthcare organization, to have data scientists, AI experts in your healthcare organization. It cannot be that you will have, in such a big hospital as mine, around 150 or 100, IT engineers and only 1 or 2 AI scientists. You have to have, fifth or fourth scientists that are dealing with the data that you are producing. You cannot produce the data and keep the data and arrange the data and try to say, I am using the data, and do not have in your position, in your hospital, at least a dozen of AI experts. If you do not have that, you cannot change the culture. You cannot create the trust. And this is, I believe, the main challenge of a healthcare leader nowadays in any healthcare organization. This is my opening, and of course I will wait for the Q&A, but this is the most important message that I think I have to deliver.
Very well. Thank you so much, Toda Rabba, Ronni, as usual, for your impulse. And without further ado, I would give the floor to Alexandra von Korff.
Thank you. Since I am working for yeswecan, which is a patient organization, I would quickly like to introduce who yeswecan is in order for you to see what we're talking about. So I quickly share my screen. Okay, never mind, that doesn't work. Or Leah, is there something we can do to quickly share?
Yes, 1 second. I will make you co-host and then it should work.
Anyway, I can quickly start talking about us and myself.
Does it work now? Sorry.
Let me quickly check. No, doesn't work. But it's okay.
Okay, now I changed something else, so now it should work.
Okay. No, it doesn't work, but it doesn't matter. because initially I said I'm gonna not have a presentation anyway. Yes, We Cancer is an organization created by a lot of cancer patients for cancer patients. I have been diagnosed in 2017 with breast cancer. Our founder had leukemia, and my co-CEO had prostate cancer. We are focused on digitalization. We have an app that is connecting patients and relatives with each other. So therefore we trust in technology. And we have just the past weekend, we had our annual cancer convention, the yeswecan, which is a hybrid cancer convention. We had a lot of visitors there in Munich, and last year we had about 220,000 visitors online. So we're quite big, and this year we used the conference to bring across our message that we want patients to have a right to access the data. It's all about digitalization and data management and handling of healthcare data. Our patron is the Federal Minister of Health, Karl Lauterbach. He was there. We had him on a panel digitally discussing what needs to be changed in order to move forward. Because even though my former speaker was saying we're not there where we want to be, we are looking up to Israel, where you are in points of digitalization. We have a petition that we have now launched in order to mobilize a lot of patients and people that want to push the subject a little bit further for Germany to continue to be more digitalized and to have cancer patients access their health data, and for health data to be available, if it's for research, if it's for treatment. As it was discussed before, I think the question of trust is a key message here. Do we trust in digitalization? I think it is not, because I'm speaking on the patient's point of view, I think the issue is not if the patients trust, it is more what the physicians do, because from a patient's point of view, we often see that data protection is something for the healthy people, because most of the patients are happy to share their data, if it's for their own benefits or for somebody else or for technology of future patients. I don't think there is, certainly data security is an issue, but I think that in Germany, the issue is that we always discuss about regulations, about laws, about what if, if this, what if then. While Israel started 20 years ago to move into digitalization, we're still talking about it. We have access to a lot of technologies. I have been speaking at the Bits and Pretzels Health Tech, where when I'm listening to all the speakers, there is so much happening in that it could be possible in healthcare. However, when I go to the doctor and I see the reality, we're talking about two different worlds, because on one side, everything is there. When I go to the doctor, I need a fax. He says, oh, can you Xerox that for me? Because we can't send it by email. I'm sorry, no, digitally, no, we don't, there's not a trustworthy system, which is not true. There are trustworthy systems. So we have to work on the trust of the physicians, because I think this is like one thing, and this is what Ronni mentioned as well, if the physicians trust the system, they are the single point of contact. At the moment you get your diagnosis, who do you trust? Your physician. So if your physician is not into digitalization, AI, then I don't think you can transport it into the patient's life. On the other side, when we talk about AI, I think it is an area where the patient often doesn't even know to what extent the physician is using AI to back up the diagnosis. Because I go to my doctor and they say, oh, this is your diagnosis. They don't say, well, originally I thought it was this, but then I used AI and suddenly I found out that I was wrong and AI corrected me. It has to do something with ethics as well. Therefore, I think we need to work on the physicians to trust, as Ronni said as well, if they trust the system, if they trust digitalization and AI, then that is the way forward. Because I think on the patient's point of view, there is a lot of trust and there's a lot of willingness to bring digitalization forward. The other thing is that I think in Germany, what the issue we often have, and this is what we want to change with our petition as well, we always, we give the options to say, okay, well, we want to go digital. If you want to also have your data available in a digital way, please sign up here, while use other countries in Europe using an opt-out method, you know, where you say like, okay, this is what we plan. If you don't want to join, you have the option to opt out. And I think for Germany, in order to catch up a little bit with maybe Israel and the other countries, we need to look into these points and move away from talking too much, but going into action. And I'm happy if anybody is looking, I'm happy to share maybe afterwards our petition, our website. I would look forward to support from anyone to bring this message forward. And that would be my point of view.
Carsten, may I add?
Absolutely, yes, please.
You know, on the focus now, we are putting AI in medicine and trust. And the focus in trust is both way for the physician and for our customers, the patient. And I put the greater challenge in the trust of the physicians.
Yeah.
And I can assure you that our patients are more willingful to trust AI technologies, and even will feel more confident when you say that this technology is based or powered by AI. Why? Because we have done that in other industries. We know that when we are doing commerce, retail in the internet, there is AI behind that, and we will be offered really the products that are really in our, I would say, cyber identity. So we are used to that. We have been told, we have been educated, trained to that as customers. So the real issue in trust is not the patient, is not the customer. Is the real customer within the healthcare, is our physician that are skeptical, that will be afraid and will say, this is not an issue for the machine. This is only experience, and the most, trained specialist will figure that out, and you cannot replace the human mind. Well, we do not want to replace the human mind. AI technologies is like a Watson. It's doing decision support. It's trying to make you understand as a physician that you cannot comprehend, do analysis of so much data and so many parameters continuously with your senses. You cannot do that. And we are adding more and more data, more and more technologies, more and more ways to understand. We are using omics, we are doing genomic, transcriptomics, proteomics, huge amount of data from all sides, take it from molecules. You cannot comprehend that. So we are just giving you a way to support your clever mind. Trust us. It was going through many auditing. Yes, not always the classic clinical study. It's not the only way to go in AI. AI is not going through the classic clinical study. It's an equation that is being, trained and being calculated day by day and improved daily, improved weekly with the data that we are adding to the system. And we will not dare to send each week the most advanced equation algorithms to the FDA to be approved by the FDA. So it's not going through the classical clinical studies. And this is the culture change that we have to try to put within our network. And you know what? How do I see that? When my physicians are meeting their fellow friends that are in the high-tech industry, that are doing the same, using the same algorithms, but not in healthcare, in finance, using the same algorithm, not in healthcare, in transportation, in auto tech, in autonomic cars, you know what, you name it. They are meeting their fellows and they're saying, hey, we are doing the same, it's the same thing, just in other industry. We are taking the same image analysis, the same data, and we can understand. And we are doing that in order to train the autonomic car or to train the auto tech industry in order to reinvent the way that we observe things on the space and the way that we are driving. And when they are meeting and they understand that they are choosing a pathway of medicine, but their friends are choosing another pathway, and it's the same thing. So they want to be the same, and this is the culture change that I'm trying to do here. And you have been in IMED in our innovation center. This is the place that we are bringing together the same AI expert that are coming from finance, they are coming from the auto tech, they are coming from cyber, they are coming from the insurtech technologies. All of them are doing the same. So if we are trusting that in order to drive safer, why not to trust that in order to operate, say, in a safer way?
Very well said. Thank you, Ronni. We already have a first couple of questions, so please, everyone, feel invited. If you have a question, either use this function to raise your hand or write it to us or in the chat. Let me start with a very, well, not basic one, but fundamental one for the whole topic to Alexandra. So what do you think about GDPR? Is it oftentimes used as an excuse for not digitalizing? And what is your experience with AI in treatment and digital health apps like yeswecan?
Well, first of all, I think that the relationship between the doctor and the patient is key, because if you trust your doctor, and often you do, I mean, you might get a second opinion, then this is your single point of entry into the whole system. You know, when I got my diagnosis, I had no idea what cancer is all about. So wherever my doctor would point me, I would go. So if I'm lucky, I am working with a doctor who is into digitalization, who is using AI to support his decisions. But if I'm not lucky, I'm in my general physicians who has not been to any conference for the past 10 years and is doing it the way we've always done it, you know? So it's a matter of luck as well. And I think this is why I emphasized as well, it's the physicians that you need to work on, or to need to convince that this is something that is worthwhile trusting. And the patients, I would say, from my opinion, and I think I'm speaking for most of them, they are clapping their hands if something is happening towards digitalization and AI. The second question was what my experience with AI is. And I have to say, from the patient's point of view, zero, because I am not, like, my doctors wouldn't tell me that this is something where AI supported me to find a decision. I talk to my doctor and they say the diagnosis is. How they got there is not, well, it's not none of my business, but it's nothing they discuss with me on a daily business, I would say.
Yeah, no, you're definitely right. And so far as we assume they just used books, papers, their own experience, we probably wouldn't even ask. But with more and more digitalization as part of our life, don't you think that people will start asking for more transparency and start to try to better understand how an analysis is actually derived?
Yeah, that's where I'd like to mention our petition again, because the thing is like we think that, just an example out of everyday life. I go to the doctors. There's no way Dr. A is sending my diagnosis to Dr. B. I have to tell my story about 10 times, and it might be that I might forget some little detail, and this might actually decide on if one doctor has this information or not. I think any patient is really frustrated. At the conference, we had a panel about the whole subject where my friend presented one of her folders with all her medical details. And why is it a folder she has at home? It's this big. And I have two like this as well. Basically, you don't have a digital file. And the hospital doesn't have either. They might have on one section, but you don't have an interdisciplinary transfer of the data. So how it works, either I get a fax or a copy of a fax, because unfortunately I don't have a fax machine in my place. So I get a photocopy. Then I go with a photocopy to the next doctor, or they send it via mail or a mail service to the next doctor. And if they're a bit more digital, I get a CD-ROM. Do you have a CD reader in your laptop? I don't,
Nope.
but this is the technology we're talking about at the moment. And I'm not surprised that there's data gaps. I, as a patient, if I am taking the responsibility, have to make sure that all my data are transferred from Dr. A to Dr. B to Dr. C to the health insurance company and everybody who is involved in this. And the cancer diagnosis is something a little bit more complex than if I have a root canal in my tooth.
Yeah, no, absolutely. I couldn't agree more. Ronni, over the past 2 years, the world was looking at Israel and how Israel really successfully again and again and again fought against COVID. So not speaking about how to combat a global virus, speaking about what this also means for the transformation of the healthcare system. Would you say that people do trust more in AI than they used before COVID, because there is a stronger focus on the benefits of technology in the healthcare system? Or did this have any effects? What's your Israeli perspective on that?
Really, on the AI, the use of AI in medicine, COVID was coming on a good timing, because we needed some kind of major crisis in order to understand that when we are confronting a huge uncertainty, we need better technologies in order to get better results and to operate these complex systems in a better way. So when we are using, we know medicine and we know most of the organism, we know most of the diseases, and we know most of the medicines, and we know treatment, and more or less we know everything, gives you some kind of an arrogant way. But COVID taught us that we do not know enough. And there's a huge area of uncertainty. In that huge area of uncertainty, if you will not have a ready-made technologies that will reduce the uncertainty, that will give you more way to understand what is the next step, what is the best way, still not on 100%, but reduce your uncertainty and allow you to go and to have better decisions in this chaotic, sometimes world. So use the data, and the countries that have done that in a better way, use the data, understood where they have more COVID cases, where it is spread, how does it spread, number of severe cases, number of mild cases, whether the epidemic is going high or down, vaccination state, anything, huge amount of data in order to comprehend and to understand what's going on in these complexities. When you use that, you are in control. Even in, relatively in moderate kind of control, but then the trust of the public, of your country went up. And it taught us, not only the healthcare system, but leaders of countries, put your investment in this industry, gain the data, arrange the data, try to have the insight out of the data. It will allow you to operate better in epidemics, but not only in epidemics that are on the acute way like COVID, but also in the epidemic of diabetes or chronic heart failure or many other kind of chronic epidemics that we are dealing with. We do not have enough data. We do not have enough insight out of the data. We do not use that enough in order to run this very high cost. Healthcare expenditures all around the world, it's very costly. We do not use that. Leaders of countries got a lesson, and they now have to remember that. Any country that is not stepping out of Corona without this lesson is going to a very grave future.
Absolutely. Wonderful. I see Yishai Shimoni, who's raising his hand already for a while. Yishai, please.
Thank you. I have a comment and question for Ronni. I totally agree with what you said about being the doorway to accepting AI through the physicians. And I'm from IBM research, and in our interactions, we have seen it often that we go to hospitals and we talk to the clinicians, and some of them, mostly, and I'm generalizing, mostly older ones, will be not really trusting the AI solutions and will say, we prefer to trust what we see in the clinic. So I completely agree with you. A word of maybe caution is where you said that we need more AI specialists within the hospitals. I think we probably do, but we have to be careful not to create silos of data. If every analysis becomes something that is specific for the data in-house, and only that, then it becomes a problem. And I think we even saw an example with COVID. One of the strengths we had here in Israel was that we could pull data from all hospitals, all organizations for this specific case of COVID. And that was a really, really big issue, and allowed to do these analyses that we probably couldn't do in a single hospital setting.
Ronni?
I'm sorry. I'm sorry, I was...
Yishai, maybe you could rephrase.
Right, so my question, I hope my audio is better now.
Yes.
All right, great.
Okay.
Yeah, so my main question, or my main caution, but question is, do you think that adding AI specialists within every hospital or within every place that has data might not lead to data siloing, where every institution only does the analysis on their own data and doesn't allow everybody else to do the analysis on the data because they already have the people to do the analysis. Why would they want other people to come into this analysis?
Siloing depends on the leadership of the specific organization and whether or not you will have data AI specialists within the organization is not the thing that will matter. The most important thing is that the leadership understands the contribution of diversity of data in order to make AI better, and not only for the sake of collaboration, but for the sake of diversity. When you are using diversity in AI, sometimes it's less accurate, but it's more meaningful. And in order, when you understand that as a leader of a healthcare organization, then you are thriving and you are going for collaboration in order to make, data analytics better, and not only just to collaborate. The sense of collaboration is to do that in a better way, more accurate way, that you have scalability of your equation. And this is the only way to go. When you really understand data and AI and the complexities of such algorithms, you do not look only into your organization. You are looking ahead and trying to look for diversities. Manage the diversity. Do not do that too much, not too diverse, but manage diversity. So, I can say that when my colleagues, and I'm speaking with leaders of hospitals and healthcare organizations sometimes, and I'm saying that in the most humble way, they do not really understand AI. So they have to get a lot of advices to understand the field, to understand the way to go, to have a strategy. And once you do that, then you will have AI specialists and you will do both within your organization, data management and algorithms, and collaboration in order to diverse your data.
Very well, thank you both. Anke Diehl has raised her hand.
Yes, thank you. I actually just wanted to comment on what Yishai Shimoni just said now. In Germany, we do have data siloing all the way through. I mean, full stop, there are no readily available data sets, that are being exchanged within the sectors. So that's the one thing. So we don't risk, having further data siloing if we were to introduce more AI specialists. But the other comment I wanted to make is, don't you think that in order, to improve AI algorithms for medical data sets, you need, there's an obligation actually to get together AI specialists and medical doctors, so people that know the important fact from both worlds, and you need them to work together very closely in order to improve medical AI evaluation as such. Don't you agree to that?
I'm trying to have the focus of your question because it was a little bit long. If you can put the focus.
My point was that I disagree actually that you should bring in more AI people, but they should work together with the medical doctors. I think that is a really important factor, that you've got the medical knowledge on the one hand side, and you've got the IT knowledge on the other side. and not necessarily a medical doctor needs to be an AI specialist, and an AI specialist won't become, you know, a medical professional, but they need to work together really closely.
I believe that you are right. This is the only way to go. And, you know, we see AI specialists that are now doing migration from other industries. And the migration is, and the adaptation is very easy because they are doing the same. They are using numbers and they are using algorithms and the same technologies and the same, more or less, data. But they need, of course, the focus and the collaboration and the interaction with our physicians, asking the right questions, going on the right directions, and this kind of collaboration, this is what we are doing. Now we're having around 15 to 20 AI data analyst experts in the hospital, and they are in different kind of projects, but they are interacting all the time with physicians. And this is really what it takes, this kind of collaboration altogether.
Very well. Alexandra, you have the last word, because then we really need to switch to the panel discussion, and David is already waiting to take over.
Sorry, it's like the only question, because I'm not an AI specialist, I'm a patient. But what Anke just said about Germany having all the silos because of data protection, we can't use all the data from Germany in order to train AI to get better. There is an initiative, it's the European Health Data Hub, Health Data Space, which is an idea to bring the data together. Is Israel away from a silo situation? Can you actually access more data, or is it a similar situation in Israel? Because I think we always look up to Israel. We always think that's how we need to do it. That's a more historical question, but do you have access to countrywide data?
That depends. Okay, first, we have a huge healthcare organization, the Clalit, which has also hospitals and around 50 of the population of Israel. So this is almost countrywide. We have also a system that is a system for medical data exchange, that the data is transferred from the sick funds, the community care, to the hospitals, in a way that I can manage and see data of the same patient that are visiting the hospital, and I can understand what they've gone through in the community. So this is, in a way, kind of a system that see a continuity of care. You know, in Germany, you have around 150 Krankenkasse, kind of insurance company or sick funds. In Israel, we have only 4. Of course, this allows us to have more collaboration and continuity of care, and people usually stay in the same sick funds. So you have better way of gathering data. And if I want to focus on a specific disease, let's say CVA and stroke, and to analyze what's happening to the patient that were visiting the hospital years before or years after the stroke, then I can go in collaboration with one of the sick funds. One is 50% of the population, one is 25% of the population, the other 2 are around 10% of the population. Then I'm getting into huge amount of numbers that allows me to have scalability in a way that I can do what it takes in order to have AI of many diseases.
Brilliant.
This is kind of an opportunity, but I'm saying that many of the technologies now allows you to bring about data from different locations. And this is what strategic leadership of any country must do as a challenge.
Wonderful. Toda rabba, vielen Dank. Thank you so much again to Alexandra von Korff and Professor Ronni Gamzu for the inspiring keynotes and insights from their perspective, and already the discussion. And I'm very much looking forward to continue this later on this year on November 28th, 29th, when we have the first annual conference of the German-Israeli Health Forum for Artificial Intelligence. So, but now without further ado, we have Professor David Matusiewicz with us, who will take the lead from here, who will introduce our panelists and moderate. And my dear colleague Leah Ledvon at the end will summarize everything. And as you know it from the previous events, just in a short while, you will find a report of today's session with political recommendations also included on our website. So have a look there. We also have just quite newly a paper on the European Health Data Space that was just mentioned by Nicole Formica-Schiller, one of our Board of Trustee members. So have a look at the website or follow us on the social media channels on LinkedIn via our newsletter. But now, David, the floor is yours. Again, thank you very much for being with us today.
Thank you very much. I'm glad to hear you. And it was quite an interesting talk until now. And the topic is how to achieve greater confidence in AI, from evidence to data use and trust. And the panelists, I have 6 panelists, and the main topic is communication on the one hand and trust on the other hand, as key factors how it can work. And I have maybe when I think about this panel, we often talk about AI in healthcare in Germany, but maybe this time we can a little bit focus not only on problems, but also on solutions, on ideas. And we start with your personal experiences concerning AI in healthcare. And maybe I introduce the panelists very, very short, and they introduce themselves with the question, what was your biggest experience on the panel or with patients, with consultants, or in the healthcare system with AI? From your practical point of view. I start with, Dr. Anke Diehl. We know each other very well. She's CTO at the University Hospital in Essen. And maybe, Anke, you start with your personal experience.
Yes, thank you, David. So I'm a medical doctor, but I'm also head of one of the largest AI consortia in medicine. It's called smarthospital.nrw, and we're developing 3 prototypes of AI, and at the same time we're also looking at transformation models for hospitals. So it's entirely inpatient data sets and hospital transformation models, change models. And in fact, one of the things that I would love to get out of this conversation is how to get AI out of that black box, that the normal citizen in Germany is looking at AI as a black box phenomenon that, well, they're kind of scared of.
Yeah, very interesting. And I've also, maybe we can talk about it later, the question, if we don't understand the human brain and the human intelligence, how we can understand an artificial intelligence. So it's very complex, and I think it's very hard for the normal people to know what it is. And I think we need practical experiences and also examples, easy examples to deal with this. The next speaker or panelist is Elan Sasson, CEO and co-founder from the Data Science Group in Israel. Elan, what is your experience?
So, well, thanks for having me here. I just want to make some comments here. So I think that in order for us to gain trust when it comes to AI, its predictive capability alone, I believe, cannot change the clinical outcome. So it must be complemented by actionable insight. And I'm a strong believer in what I call computational prescriptive medicine. So it's not about telling a doctor or a clinician, your patient is going to deteriorate in the next 5 hours in probability of 0.65, probability, but also provide some explainability, but also some actions, how to change the medical outcome. I think it's very important. And I understand that there is a lot of, concern about black box. Yes, I was trained as an engineer. Actually, I lecture at Tel Aviv University, graduate student, machine learning, AI courses. And we do have, I would say, some surrogate models how to unbox the black box, right? If you look at the deep learning models, yeah, Professor Gamzu was right before, there is no way for us to peer into the internal of the model and understand the structure. But we do have ways how to do that, how to black box the black box, giving some local explainability for a specific prediction. In the COVID-19, we developed an AI system to predict the deterioration of COVID-19 patients for the hospital of Ronni, but to another large hospital in Israel, Sheba. And the whole idea was to, first of all, to provide explainability for each specific prediction, and actually provide some insight, a visual insight to the clinician about the clinical feature contribute positively or negatively to a specific prediction. And this is very important to gain confidence. Another thing that was mentioned here before, it's what we call HITL, which stands for human in the loop. I refer to it as a clinician in the loop, CITL. And I think clinician should be in throughout the whole process. When at the very beginning, when we look at the feature, when we do feature understanding, and when we do a feature cleansing, and when we put something deploy in production environment, it also has to be monitored over time, because data shifts and data skewness will affect your model performance. And this is something that also is being addressed by the FDA when it comes to SAMD, software as a medical device.
Okay, thank you very much for your comment. It was a quite a long comment, but a very interesting comment. And the next speaker comes from the industry, Yishai, Shimoni, Manager, Machine Learning for Healthcare and Life Sciences from IBM Research in Israel. Yeah, Yishai, what is your experience in Israel about when you talk with people who are not a machine learner?
Right. Yeah, thank you for having me here again. I think this is something that that is complicated. A lot of people are indeed afraid of that black boxy thing that AI is portrayed as. I think it's a misrepresentation, because people are also black boxes, as you mentioned. But that's the way it is. People do expect machines to, or hold them to higher standards than they do people, and we have to deal with it. We at IBM Research believe that it is important to create models that are trustworthy, both in the classical AI sense of being reproducible, transferable to other data sets and so on, but also in the sense of being fair, trying to make sure that we have a diverse population, that we can show that we don't have biases towards one population versus another. And we published a package for creating data analysis for what's called causal inference, where we're looking not only at predictive outcomes, like Elan was talking about, looking at what is the effect of an action. So looking at the effect of treatments, the effect of prescriptions, the effects of procedures, and how they affect various outcomes. And I think one of the main points to allow acceptance of this package was really focusing on evaluations and trying to show that the predictions of these models are trustworthy. And I think that worked, and there's a lot of adoption over the last couple of years.
Okay, thank you for your statement. The next panelist is called Christian Storm. He's CEO and co-founder of the TCC GmbH in Hamburg, in Germany. And Christian, what is your experience talking about AI in healthcare?
Thank you, David. Well, as a third-party tele-ICU provider in Germany, we of course do have experience in different areas, mainly in the field of intensive care and management of high complex patients. My background, I'm an intensivist, and I spent most of my career at Charité Berlin and switched to Johns Hopkins and MIT in Boston and Baltimore for a couple of years to gain more experience in the field of AI and machine learning. And what we do right now as TCC, we develop our own algorithms to predict, as many speakers already highlighted, to predict different endpoints for ICU patients, such as early prediction of sepsis onset, early prediction of AKI to prevent patients from AKI and other complications that they can run in being on ICU, and of course also predict kind of when are they ready to discharge from ICU to allow a resource planning and create benefit for the patient. However, I also would like to comment on the main question you raised already, and I think it's about. I was listening to the statement that we have a like a quality that is different, and the treatment is matters on luck. It's luck whether you have a good or poor medical treatment, and actually that's definitely not acceptable. And I think using as many data as possible today and in the future, it's highly important for us to create a higher awareness. We heard already about let's say problems of acceptance in physicians, so it's important to create awareness, but it's also important to address fear, the fear of the computer is making a decision about my life or whether I die or not, which is definitely not the case and not true. It's not AI that treats the patient. So finally, it's AI that is mitigating or analyzing lots of data, but the final decision about the treatment will be made by a physician. And therefore, I think that's highly important to, if we want to increase the usage and acceptance of AI and AI tools, it's important to create awareness, but also to tell the truth, what's going on and what's not going on, and what's not the truth about AI.
Okay, thank you very much. I think it's a very important aspect. We can say that AI is like an instrument, a different instrument for the doctor, not more and not less. And so it's not the magic something what happening, and the patient is under control by the physician, and he leads the therapy, the diagnostics also in the future. Our last panelist is Laura Wamprecht, Managing Director from Flying Health in Berlin. And Flying Health is a next generation ecosystem and helps a lot of companies to get market access, maybe startups market access with AI in the healthcare system. And for you, Laura, I've also questioned a lot of startups today say they have an AI in their apps, but it's only an algorithm. And we have a quite inflationating AI topic. You know, when we talk about pitch decks, everyone has AI today, but I think not many startups had real AI in their development. How you see it, and welcome.
Thank you, David. So I definitely agree. So we see many startups, and it's like once we had a summer where blockchain was a thing, and I think AI is still a buzzword for more or less everyone. But actually, my personal experience is also more a non-experience. So like Alexandra said, you don't know what your physicians are using for a tool. And I think especially in Germany, we had the awakening with the Hospital Future Act, where there was, which is a great funding program with 4 billion euros invested into digitization in hospitals. And one aspect which is able to be funded is decision support systems and kind of AI systems. And what we realized is that hospitals came to us requesting, okay, we find patient portals, we find telemedicine services, but actually we are looking for AI solutions we can implement. And to be honest, there are none, more or less, maybe a few of them. So I would like to name VARA, a service screening for breast cancer. They are already certified as a medical device, which is quite impressive, or Ramp Medical is quite advanced. it's a decision support system for medication checkups. So there are only tiny companies and only a few of them who are really moving forward. And this is when we were looking for AI companies. We definitely found some in Israel, like I think this AI and Zebra, they are coming from your side. And the reason why I think this is the case, what we learned from our big corporates like Siemens Healthineers or Johnson & Johnson, who are developing AI somewhere in the United States, they say we don't have the clear regulatory framework in Germany and Europe. So they are more afraid of, okay, we don't want to do something wrong. We need guidelines, we need regulation. And if an industry is calling for regulation, you definitely know there's some homework to do.
Okay, Laura, thank you very much. Our topic is communication and trust. So let's start with one point. It's quite interesting for me. I'm looking at the AI topic for 10 years about, and it's confusion. A lot of people, scientists and companies say, hey, we have the big AI and the cars are driving by themselves and collecting data and everything is digital tomorrow. On the other hand, some other people like Steve Wozniak a few weeks ago was here at a big summit, Telecom Digital X, and he said the sentence, AI is not real intelligence, it's not even like an ant's brain. You know? So AI is quite stupid. So I read in the media day by day, AI is stupid, AI is very clever, AI will replace the humankind, AI does not help. So what's the truth? And how we can deal in the communication field with this conflict. On the one hand, people say AI is everything, and on the other hand, people say AI is just a buzzword, not more and not less. So who wants to start? Maybe I start with Yishai, because you are a machine learner. So maybe you can tell us what's about this conflict.
Yeah, that's actually a really good question. And so there's actually a difference between AI and machine learning. Machine learning is just a subset of AI. So machine learning is not necessarily the intelligent, artificial intelligent machine that understands everything. It learns. It's a machine that learns patterns in the data. That's basically what it is. And I think part of this, as you say, is the problem of communication. Yeah. We have been communicating this probably in the wrong way in some cases. There's a lot of hype in the press about what AI can do versus what we actually do in machine learning, which is finding specific answers for specific questions. And so I don't even know if we can term it in the terms of being stupid or not being stupid. This is not even the relevant question. It can answer specific questions. If we have the data, it can find questions that a human being cannot find in this data because it's just too much. And that's where it starts and that's where it ends.
And we talk about communication. Can you give me a very short definition of machine learning and AI, the difference? Because for me, AI is kind of strategy, vision, and the machine learning is the operative doing. But how you define or separate it?
Right. So machine learning, I would say, is creating eventually a computational model that can answer a specific question using data for training that model, for finding the right parameters for that model. AI is a really much broader thing. It's artificial intelligence. It's anything that you can build that can answer questions using, but not using a human, but using some artificial means. So in 2 sentences, this is my answer.
Okay. I heard a definition once ago from, I think it was Cisco. He said, when I talk with 2 people behind a curtain, and on the one hand, there's a real person, on the other hand, there's a machine that I cannot separate it. I don't know where's the person, the real person. Then we talk about AI, because AI is quite as good as the human. But everyone has a different definition. And I ask you in the panel, who has maybe another definition and how we can easily communicate it. Maybe you raise your hand or just talk. We are not so many people. Ellen, yeah.
So I just really want to echo with what Yishai said. I think there's our inflated expectation about what AI can do or cannot do. And I think that there is a major distinction between what we call narrow AI, which is more task-oriented, than AGI, artificial general intelligence. And that's what you're referring to. And there is a lot of inflation nowadays in the media because of those large LLM, GPT-3, DALL-E 2, large language models that we believe that the machine has some intelligence, human intelligence. And I think what is missing from the machine is the human intuition and creativity. And we still, as Yishai said, we still don't understand the human mind, and we cannot take the human mind and put it in a box, in a machine. This is I don't know, maybe 50, 60, 100 years away from us, but this is about singularity and so on. And basically, I believe that when it comes to AI and healthcare, it's about a hybrid, I would say, diagnostic setting. When you use the precision of the machine, as Professor Gamzu mentioned before, looking at patterns in large data sets, right? But human cannot really understand large data sets, and the creativity of the human. At the end of the day, it's a decision support system. So I don't think AI in the near future is going to replace human, but also to replace tasks. And if you in the last comment, I would say many AI or narrow AI that we have today can actually mimic what we can do as an adult, but there is no machine that can mimic a newborn baby.
Okay, thank you, Elan. Maybe do you have in the panel a very easy example? What is when you think about AI in an app or in a software or in this other solution, Internet of Things, whatever? What is your best experience? Not experience, your best example when you talk with those people and someone asks you, where can I find in my daily business or in my daily life AI? What is your best example? Because we talk always on the meta level about AI, whatever, but let's talk concrete about one solution. Anke.
Well, as you know, I spent 11 of my years as a medical doctor in radiology department. And I think in radiology, we do have plenty of examples of AI solutions that really work. And also the solutions that Christian Storm actually mentioned, you know, to combine multiple data sets in order to come to precise predictions. They're the type of AI solutions that really help to improve the quality of medicine and to improve the clinical decision support, basically. But you know what really struck me when we were talking about this was Alexandra said, well, you know, the patients don't know anything about that. And that is the normal thing. I mean, if you're a radiologist, of course you don't, you know, explain all the technical details, even without, you know, AI. You wouldn't say, well, in an MRT sequence, T2, we saw that, in T1, we saw that, in FLASH, we saw that, whatever, you know. It doesn't play an important role in the message that you want to get across. And it also, it's only technical help, you know, because as we figured out beforehand, the most important thing is the patient-doctor relationship, you know, and that is essential also to the outcome of that therapy, you know. So for me, actually, AI algorithms are just part of that decision support, basically, and they just assist you.
Okay, that was a very clear message from the B2B area. You know, in hospitals, we have radiology experience in AI, and maybe someone can add an B2C example where you, as a consumer, as a normal person, use a tool in the healthcare area or somewhere else where a strong AI is also implemented. Yeah, Christian.
I think my daily life experience, for example, with Netflix, you watch a movie on Netflix or two, and then you get a recommendation, which is kind of a decision support, as Anke mentioned. It's kind of a modern decision support, what to watch next. And what the algorithm does, it's going to analyze my pattern of what kind of movies I like. It's not intelligent at all, and it has nothing to do with human intelligence, as we have heard already. And I think this is a point we have to make to create awareness and well, maybe the term of naming it artificial intelligence is kind of misleading and is creating rejection right now, because I mean, pattern recognition in my expertise and in my medical field, pretty similar actually to radiology. In intensive care, you have more than 1,000 data points per each patient each day. You have to bring together to find the optimal treatment at any time, any second, 24/7, which may get complex if your patients are complex. So it's about a pattern recognition and getting a clinical decision support in what to do next, and or what is the risk to develop a, for example, acute kidney failure. So it's not the computer that is intelligent, but the computer has the power to analyze millions of data points at the same, like in a very, very short time, giving a prediction. And I mean, we do have it already, as Anke described, in radiology, but we also can see it in dermatology, for example, and pathology, which is all about imaging. And then the rest and all other fields in medicine are kind of underdeveloped and have to speed up a little bit.
Yeah. Short story for me, I was yesterday in Essen in a cinema, and I asked the person behind the ticket counter, he should give me a reference for a good film. And then then I went to the film called Bullet Train with Brad Pitt, because he said, hey, great film, but it was not a very good film for me. So human to human doesn't work. And Christian, do the algorithm always gives you the best films, or also has experience the AI also make failures?
Well, actually, I think AI works a little better sometimes, because it's already recognizing and analyzing what happened in the past with me interacting with Netflix, for example. And therefore, it works a little better. That's my personal opinion. And I do like it. I do like the support in you know, what to choose and what to do next. And if I don't, I mean, I don't have to follow. Yeah. That's another thing. I have a choice every time. I don't have to follow.
Yeah, but the risk is, and then we come to Laura, you maybe, I just imagine you like Bollywood films, so you always look Bollywood films and you never go out of your bubble, because the algorithm is even better, and you never choose by luck or something else, another genre, another film category. Is it not the same with newspapers, the same with music? Isn't it a risk also?
Maybe, but that's the difference between myself and a computer. I have a human intelligence, so sometimes I can, you know, try to break out of this and find something new and discover a new field of interest. For example, watching like a different Hollywood movie than Bollywood or whatever.
Okay, yeah. Thank you, Laura.
Yeah, I also wanted to add that what the algorithm is able to do actually is surprise you. So it's going even deeper into one direction. But the question is, when we talk about entertainment, that's probably a weakness. But when we come back to medical grade, that's probably also the better way, instead of having irrational jumps in the diagnostic part. What I also like to explain, or what I find is really fantastic, is speech recognition. So finding patterns in speech and voices, and I think there is a lot of untapped potential, because I think AI is, especially in healthcare, is mainly focusing on images, because there's some experience, and there, like radiology, dermatology, there's a lot of use cases which are very obvious. But I think also having vocal biomarkers for predicting, for example, depression or something like that, I think there's still a lot of potential. And also the merge with robotics. So this is where also I think the fear is sometimes coming from, when people think about human-like robots who are taking over everything. It's coming back to the movies. But I think in total also the idea of having this artificial intelligence claim, someone mentioned maybe we should rephrase it. I don't know, because what we see is that we are coming into, in the next 5 years, we will have a demographic shift, and we will need technologies who are able to replace what people are doing manually as humans today. And I think we should be more open to the idea that technology can take over more responsibility in healthcare.
Okay, thank you very much. And we talked about half an hour about communication, and let's talk the last half an hour about trust. And when I see the AI studies, and I think we have over 1,000 studies or more even nowadays about AI in healthcare, and there's often the result is often that sometimes the intervention group, the AI, is better than the control group than many people. Sometimes the people are better than the AI, but always, to my mind, or very often, the combination between humans and AI together are more powerful than only AI or only the humans. And maybe this is one, for me, that it's one reason why we have a bigger trust today than some years ago. And let's collect some other trust keys or trust topics now. What is your opinion about how we can improve trust in the black box AI? Because maybe one question more, one example more. Years ago, a doctor had publications or papers or books, and he read a new method, and he saw in the literature who wrote this paper and so on. He has a transparency, and now he has an app, and he cannot look inside the code, the normal doctor, and he must trust that the code is right. And that's quite hard, because I cannot understand what I'm doing. I'm using something, but I cannot read, like in a book, who wrote it and what happened before, and read other studies and so on. It is a little bit harder for the physicians, but maybe you have also examples how we can improve it.
Yes, I actually have an idea about that. I think just like it used to be that a paper would have citations, and so if a doctor read the paper, they would not only read the paper, but they would look at the citations and say, "Oh, yes, this is based on other known science." Yeah. The same thing should happen with the apps. If they're using some specific AI technology, that AI technology should be referenced. There should be a link to that AI technology. The AI technology itself should probably eventually, at least the core of it, should be in some public domain where people trust it and keep using it. And you see that there's trust is something that you build, just like in humans. Trust doesn't just happen. People don't just wake up and say, "Oh, now I trust AI." It's not going to happen like that. It's going to happen by baby steps, where we see a solution that works and we see another solution that works, and slowly we build on. Okay, so all these apps that work use that solution or use that technology, and now we start to trust that technology.
It's a very good point. So maybe we need a human reference group, key opinion leader, who say, "Hey, this AI is used here and here, and we think it's a good idea and a good AI," and maybe it gives them more trust. Yeah. Okay.
The trust by references and by citations and some metric, again, similar to papers, where you can say, yes, this is something that's been used and can be trusted.
A little bit like Wikipedia, which is also trusted by a lot of community people who work on it. Okay. Anke.
Yes, I absolutely agree with that, because what it would do is it would actually make it more publicly available, as in, PR work about using AI for decision support. But one of the things that I wanted to bring up, talking about trust, is what we haven't talked about at all yet, which surprises me, is we definitely have to get rid of bias, you know, and that is something that always stirs the public very much, you know, when you have, you know, representation bias, because your population group is underrepresented, which often happens in clinical studies also, you know, when you've got European male population and other ethnicities are underrepresented, or evaluation bias. If you think of, you know, facial recognition algorithms that didn't recognize dark-skinned females, or aggregation bias, even historical bias. And I'm aware of the fact that over the last 10 years, a lot has been solved there, but still, you know, it's things like Amazon scrapping its recruitment tool that stir the public tremendously, because they kind of think, wow, you know, AI actually chooses now the new employees of Amazon, and no women were recruited anymore, you know, and that kind of remains in the public domain, and you can't get rid of it anymore. And to my opinion, that is a real, that really spoils trust in AI.
Okay, thank you very much for your statement. When we talk about trust in the healthcare area, it's very important, because you need a long time to get trust, and you can use it very fast. It's not only in AI, it's in the normal daily life. And one example we had is Ada Health. A lot of people know it in Germany. They have 20 million decision support cases, and 10 million patients until now, and they focus on America, on USA now, but they had the problem. They developed an AI and worked with our biggest health insurance company in Germany, the Technica, and then they had a small scandal. They used their data for cookies for Facebook to target the group, and then they lose a lot of credibility, and from that on, they had lose trust and had big problems to get to the stage they were before, to my mind. Maybe other people see it in another way. And yeah, is it a big threat also for the companies? They work hard for years, and then they make one mistake, and the media comes, and then we are also in the communication part. The media comes and everything is gone because they lose their credibility? Or is it normal that such companies make such failures, and we must give them the chance after the scandal to work on? Laura.
I think it's also the experience of being a pioneer, because they were one of the first startups being in this way successful. So they were watched very intensively. And I think also consider now how many hacker approaches we had in healthcare during the last 2 years. Large companies like also the Compo Group Medical, like the Data. So I think there is now the market is sensible to the idea that there is no total security. And I think if this would happen again this year, it wouldn't be a scandal anymore in this case. So I think actually it's very sad that the market reacted so hard. And on the other hand, I think you can also congratulate Ada to finding a better business model. I think they're doing better somewhere else. So that's also a pity for Germany. We missed out a chance.
Yeah, thank you. And now the further question is from our Israel colleagues. Do you have a good practices on building trust in technology?
I think the answer is no.
Yeah.
Otherwise, we would be much further down the road.
Because our health minister is always traveling to Israel to get some good ideas, and I also want some good ideas from you.
So let me say something. We were talking about models here, but nowadays the trend in when it comes to the machine learning and AI community, it's more about data-centric, being data-centric, and we have to have some understanding of the data quality, because your model is good as your data, and there are quality dimensions to the data. And when it comes to EMRs and genomic data and other sources of data, quality become a major issue. And I think this is something that can help build trust, because if you feed your model with data, you're going to get bad prediction. I mean, at the end of the day. So it's not just about being model centric. It's not about the model, trust me, but about the data. And the data is a key component when it comes to trust in AI and in machine learning in general.
Yeah, and to my mind, there's also a little bit a myth that we need big databases for good AI, because when I talk with AI people, they also say, hey, when something's big, it's great, but we also can make a good AI with small samples when the data is good. Yeah,
we don't need a big data. We need good data.
Yeah, okay. So not only big data, small samples are also okay when the data is very good from the quality point of view. Okay, let's sum a little bit up and come to the end of the discussion, and then we maybe ask some other people in the Zoom what they learned about the session, and maybe we when you have a wish for the future, how we can improve communication and trust. What is your wish? Is it a wish for the politicians, for the people, for the industry, for the scientists? What is your biggest wish to go? Yeah, we talk about baby steps to go not a baby step, a big step in the future to improve the healthcare system with AI. Maybe I start with Elan.
So I think the real obstacle to unlocking the AI full potential in healthcare is data sharing, and I think it was mentioned before. I think that, let's put it this way, there is a tendency among the key players, HMOs and hospital, not to share data, okay? To keep the data from any reason. Some of the reason has to do with GDPR, with privacy issue, but I can assure you that there is no technical issue with data anonymization. I just something from my own experience. When I mentioned before that we developed during the COVID-19, when at the beginning of the pandemic, for one hospital in Israel, we developed an AI machine learning algorithm for predicting deterioration. And I wanted to, I just had like 500 or 600 data points, which is not enough, as you mentioned before, David. And I really wanted to test it and validate it against unseen data, so to speak. With another hospital, I got really a blockage. And hospital, they don't share data. Let's put it this way. Let's be honest about it. And it has something to do with the regulation. The regulation has to impose data sharing, and there are technology to do that. I don't want to get into it, but just to mention federated learning algorithms.
Okay, thank you very much. So sharing is your biggest wish. We must share data to develop better AI. Christian, what is your wish concerning improvement with AI?
I think one of the most important steps, in addition to what Elan mentioned in terms of data sharing, it's about developing the regulation and law to be up to date as well.
Okay, thank you. Short, clear message. Laura.
I can also make it very short, because I agree with Christian that we need to create a regulatory framework to leverage AI. Okay.
First of all, the politicians must understand AI. That's maybe the first problem. I'm here next to the Bundestag in Berlin, 100 meters far away. And 2 years ago, I was invited to a enquete commission on AI in the care industry, Pflege. And we talked the whole day and come to the end that there is no AI in the care area until now. And then was the end of the session. So the politician must first understand what we're talking about. Maybe Yishai.
Yeah, of course, I agree with everyone who came before me. I would say it would be great if regulation was also somehow conformed across different localities. I know it's probably never going to happen, but these differences between, even right now, HIPAA and GDPR make it so complicated to do things. Being able to have some international regulatory governing board or something would make things so much better for everyone. I think there's also another aspect that would be useful for me in IBM and probably for others here on the panel, where I think there's a conception both in the public, but not only in the general public, that for-profit companies should not have access to wholesale data, and just because they're for-profit. And I think that is a misconception. And just the fact that a company is for-profit does not mean that they cannot be eventually very useful for healthcare. I think that's definitely, everybody understands it when this is a device, a medical device. Nobody expects a non-for-profit company to develop medical devices. But when it's something like AI, then it becomes an issue. So that's something I think a public change in conception would go a long way.
Okay, thank you very much. And Anke, you have the last word. What is your biggest wish?
My biggest wish is actually, I would love to have the same sort of databases as you have in Israel. Can't we put all the statutory health insurance data sets together, you know, and would actually have access to a series of data sets from all sectors, and not only these tiny secluded sectorial data sets that we've got access to now at the moment.
Yes, we talk for years in Germany about a so-called public use file, but nowadays you must, I think, until now it's the same, that you must go to a government company in Germany, Cologne, and you must have an USB stick and put your USB stick inside, and you have a code, and it's very complicated, and it's normal routine data from the healthcare system. We have the data, the health insurance has the data, but it's hard to get even as a scientist to a big access to the 70 million people data, to have some easy algorithms like incidence, prevalences, comorbidities, and so on. We have a lot of publications we are not making because we don't have the access until now. Maybe you can really learn from Israel. And I would like to ask Alexandra and Ronni what you have learned concerning the session. And Alexandra, I was very glad to join your conference because it was quite kind of trust and communication conference in the cancer field in Munich last week, and what you have learned, and maybe for your daily business.
I think the wish is the same on every side, that we, you know, without data, there's no digitalization. Without digitalization, this is like the base for working with AI. This is what I learned. Well, it's not new, but I think we all agree that in Germany something needs to change, and we can probably look to Israel and learn a lot of things as we already knew. So that's what I take as a takeaway for me. It is, yes, I hope that the physicians are seen as the single point of contact to be educated, maybe, who isn't open for AI and digitalization, maybe work on their mindset and educate and talk about it and get the word out.
And Ronni, what are you talking or thinking about now after the session? When Ronni is available, or maybe not. Okay, maybe comes later on. So I think, yeah, we have a few minutes left, but yeah, we talked a lot. It was 1 hour about AI in healthcare, and I think communication and trust, it's quite easy and obvious that it's very, very important on the one hand, but on the other hand, it's clear that it's very, very hard to get here further steps, because AI is quite complex. We learned communication is quite complex. We talk about the B2B area, the B2C area, and trust is also a very, very complex field. But I think if we try it, and we need maybe some experimental fields on the one hand, and we need data access and big data data sets in Germany who are combined with each other, and a lot of success stories in the future to get more about positive communication, because I'm sometimes very critical concerning the media. I don't know how it's in Israel, but in Germany we love negative communication and negative media. We have, when you switch on the TV, it's always about crisis, about we have no power in the future, we have high prices, we have war, and so on. And I think we must communicate positively concerning AI in healthcare and digitalization in healthcare, and have a lot of success stories. And the people, the normal people outside, would also be more positive if they heard more positive news and information. So thank you very much for having me, and thank you to the panelists for the talk. And yeah, and I give the speech, the talk, the word to the next moderator and the Q&A session now. Thank you very much.
Thank you so much, David. I will take over. And I would, like I already asked in the chat, ask all of the audience if there are any questions, please raise your hand or just write it down in the chat. Otherwise, I will continue, because I had some really interesting insights from all of your of the keynote speeches and also the panel. What I found very interesting is the culture of trust in a hospital. And maybe we can start with all of our clinicians here. What do you think? What is a culture of trust in AI in a hospital? What does that mean? And what do you think needs to be done in that case? So maybe Anke, you want to start?
Yes, I think for AI algorithms that have been validated and integrated into technical systems, there's no problem at all, because they're just being used as technical support, how to analyze the exams that have been taken. And I think as long as user orientation is normal and good, you know, there's no problem on that side. I think that especially the medical doctors, you know, just accept these technologies just as other advances in technologies, because it's part of our medical professional laws that as soon as there's evidence that something provides us with a better diagnosis, then we must also use it. So I think, you know, when it comes to these automatic AI algorithms that help us read diagnosis or exam results more clearly, to my understanding, there is no problem, you know. Most of the other things are more experimental at that stage. And I think that is, you know, where the problematic area comes, but not in university hospitals. And as I come from a university background, I'm sure that that is completely different to other hospitals and other doctors here.
Thank you. And we have another clinician, Christian. Maybe you want to add on that. Do you have colleagues where you believe the culture of trust in AI still hasn't really reached them? Or do you also think that, especially in university hospitals, there's no problem with that? And maybe there's a problem, or there is no problem at all when it comes to GPs, for example, or other health caregivers?
Thank you for the question, and I fully agree to the statement made by Anke. I definitely think that it's highly important that we understand that the amount of data that is coming in, whether you are a physician at the university hospital or a general practitioner running your own office, it's highly important to just to understand that the decision support is just a support. It's not treating your patients. It's not about making any decisions. And I think understanding what a pattern recognition or an algorithm is, it's about a mathematics. It's not a miracle, and you can explain what it does and how it works, and that's highly important. And that's going to create a kind of a knowledge maybe in our colleagues that are so far not believing or do have any fear in using it or accepting it. I strongly believe in times of lack of staff in the hospitals along the whole way from lack of general practitioners up to lack of staff in highly qualified university hospitals. It's of importance to implement new ideas, new solutions, and to use the data that we produce in daily routine. We have to. It's kind of a must. It's not a question if, we have to.
Thank you very much. I guess Yishai and Elan would also agree on that, especially also when it comes to communicating about using data. And I think this panel also really shows how many people are involved when it comes to creating trust in AI and healthcare. We have patient representatives, we have startups, we have developers, we have data scientists, we have doctors. And maybe I would like to invite Limor Schmerling also to the discussion, because she asked or gave another note with regards to data. Limor, are you still here?
Yes, I'm here. It wasn't all that important.
I think it is. I think it is. So please, yes, I think.
It was way at the beginning of the conversation when we were mentioning and I think discussing the connectivity between organizations and the fluency of data within the system. And the point I wanted to make, because there was a comparison between Israel and Germany in terms of the structure of the health system, and what I wanted to point out was another advantage that Israel has that wasn't something people thought about, but it created a real advantage, is that the only 4 entities that we have who are the sick funds, or the health management organizations in the community, are also the insurers. So there's no separation between insurer and sick fund in Israel. And that creates, I think, a very dramatic leap in the fact that all of the information, not only the medical information, but also the administrative information is managed, and the financial information is managed within the same one legal entity that has the purpose, the goal in life to give good health care. And the system of subsidizing / funding the sick funds in Israel is that it promotes and incentivizes the sick funds to keep people healthy. So the allocation of funds, of resources per patient is equal. So the health organizations, the sick funds, have an incentive to keep people healthy, because then they spend less money on health care for patients, and they have an overall more resources and budget. And I think that that also gives, that doesn't have to do only with data, but it gives a good push to wanting to innovate. Because if you want to do precision medicine and to save on expenses, to have better health outcomes from healthcare, because you're incentivized to keep people healthy, then you want to innovate, you want to use the data that you have, you're incentivized to keep people healthy, then use the data, use your resources, and drive better healthcare. So I think all of those incentives, I think it's worthwhile thinking about the whole business of innovation in healthcare and data use and access and sharing in healthcare through the eyes of incentives, and who is incentivized and what stakeholders, what actors. what type of incentives the government on the national level is giving those entities in order to drive their healthcare and innovation in healthcare. So that's it. Thank you, Leah.
Thank you so much. So if there are no questions, are there any questions from the panel or from the audience? No. I would like to sum up. So I think we all agreed on that the patient-doctor relationship is crucial and is very important, but there is more to that. It's also, like Professor Gamzu said, that we need a culture of trust in the hospitals, and I guess this would spread out also to the whole healthcare sector. Especially from the German side, I heard that we need a regulatory framework which gives also doctors, but also the industry, well, an idea of what kind of AI-based application they can actually design and use. This is also something we talked about in our last regulatory digital health roundtable. You can also see it on YouTube. We really spoke about the European health data space a lot, for example, and the secondary and primary use of data, and how a European-wide or maybe even an international framework, because when we talk about data, we also talk about interoperability and standards like FHIR, and I think that's something that's relevant for all of us, for all countries. So you can also check that out, but we want to, well, continue the discussion also next year. So I think there's a lot more to talk about. And lastly, the data quality is extremely important. It's not only the amount of data we have, but it's the data quality. This is why I'm also very thankful for our data scientists who joined, and all of you. Thank you so much. We will wrap this up with a short report that we will send to you in a couple of days, and you will find this session also on our ELNET YouTube channel. Thank you.